connection.
Okay, good morning. Let's have a class. And we will continue to talk about bacterial disease. And to kind of let you know, we already talked about corynebacteria, diphtheria. And we talked about Haemophilus influenza. And we talked about Neisseria meningitis. And we also talk about Bordetella pertussis. So we finished talking about these four passages. And today we will be focused mainly talk about Streptococcus and Staphylococcus. Okay, so Streptococcus, just like SPP, and Staphylococcus. So here is something we want to mention at the beginning. Characteristics, both of them gram-positive. They are all coccile. COCCI, they are all coccile. What's the difference? Is the morphology. Streptococcus is chain shape. Staphylococcus is grape shape. And it is a cluster. So this looks like this, a chain, and this looks like a grape shape, a cluster. However, in the real life, it is difficult to identify sometimes because the chain could be looks like this. So what we should do? Then there is a very quick test called a catalyst test. The catalyst test is usually in a glass slides. You put the bacteria there, then you're adding H2O2, hydrogen peroxide. If the bacteria has catalyst, it will be released oxygen and water. And how do we know there is oxygen there? It is bubbling. Okay, so this is a very quick test to know Streptococcus and Staphylococcus. Streptococcus catalyst test negative, Staphylococcus catalyst test positive. And we will talk one more time when we do the final conclusion. So just want to let you know, the overview picture of these two bacteria looks like that. Another thing I also want to mention is Staphylococcus and Streptococcus. If you really want to write the acronym, they're all S dot. However, at the beginning when you learn, I don't want you to confuse by yourself. So what I will do, STREP stands for Streptococcus. STAPH stands for Staphylococcus. Okay. Later on, if you're already familiar, you could only write an S. So let's talk about that, the detail. First of all, we will talk about two bacteria, which is Streptococcus. Now you still remember this slide, which is alpha hemolytic and beta hemolytic. So these two bacteria both are alpha hemolytic, which means on blood agar, their incomplete hemolysis of blood cell and turn to kind of like a dark green color. Now, what are those two bacteria? Streptococcus ammonium and Viridine streptococcus. Viridine strep. So we first of all want to talk about these two bacteria. both alpha hemolytic. And we also talk how we differentiate that, okay? So first thing first, Streptococcus ammonia. Streptococcus ammoniae is very easy to understand it. Since it has a genome name, Streptococcus, species name ammonium, of course it's called ammonia. So what does it look like? Gram-positive coccale. The chain of this bacteria is very short. Diprococcale. So looks like packaged with a heavy capsule and two of them stacked together. And this outside is packaged with capsule. And these two stacked together with quite a long, thin shape. It's a diprococcale. This will be responsible for 80% cap in the United States. What is a cap mean? C stands for community. A is acquired. And the P is ammonia. So it is responsible for 80% of community acquired ammonia in the United States. Keep in mind, this is for adults. This is for adults. Okay. Now, what's the symptoms for ammonia? You know about it. Fever, cough. Sometimes you have a chest pain. This is a very typical symptom for ammonia. A productive cough sometimes. And this pathogen, if in kids, let's say 5-year-old or about 2 to 5-year-old kids, it will not have ammonia. Most of the time, it will have otitis. What is otitis means? You have a raining, you're feeling about you're hearing something, you have buzzing, and you have ear pain. So for the kids. How about the infant? If it's infant, this is sometimes this bacteria, because of the heavy capsule, so it is very invasive. What happened? It will cause two different results: bacteriemia and septicemia. Both are not good, which means bacteria in blood. And this is something you need to know. Our blood is sterilized. They should not have any bacteria there. If bacteria there, that is not good. It's horrible almost. There is a two different kind of the situation related to that is bacteriemia. That means bacteria colonization, which means stays there, and also multiplication, which means they grow there. And septicemia, they only colonization, which means they only stay there, but they didn't grow. But both are not very good. How about old people? And we talked about already, if it's more than 40-year-old, have Streptococcus pneumoniae will cause meningitis. So this is the one is talk about Streptococcus pneumoniae. Okay, now then we want to talk about the second one. Is Viridine streptococcus. This is very interesting. Why do we want to talk about that? Viridine streptococcus, widely existing in the oral cavity. sputum sample. Let's say you have a cough. You get a sputum sample. You say, I want to do isolation. It is difficult to do because it's going through your oral cavity. And in your teeth, in your mouth, in everywhere, there is a viridine streptococcus. What are the examples? It could be Streptococcus mutans. It could be Streptococcus bovis. Lots. Now, what's the risk of the viridine streptococcus? If you hear about a 70-year-old, let's say a 70-year-old grandma, and go take out of the wisdom teeth, and then a couple of days later, she is dying. It's not a surprise, because it will cause subacute endocarditis. What means endocarditis? That is inflammation of heart valves. But it's subacute. So what happened is a couple of days, couple of weeks even looks good. However, all of a sudden, it started to die because the people really not recognize it. It's take off the wisdom teeth, especially the older people. And most of the time is they failed the oral surgery and the hygiene process. So it's a risk. So that's a very nice streptococcus. Now we back to here. We talked about on the blood diagram, both of them, Streptococcus pneumoniae and the viridine streptococcus, or alpha hemolytic. So you're not going to see the difference. And then you go to do a gram scan. It all looks like a gram-positive coccale chain shape. Well, sometimes it's diplococcale, but it's difficult to do in the real life because it's a mixed culture. So what we do? In the clinical area, we could differentiate that. We're using a very special tool called the P-disc. The P-disc is separated into two halves, and they containing one of the disc piece there, which is containing the components called opticam or optichan. Okay, once the optichan is there, what is going to happen? If it's Streptococcus pneumoniae, it will be showing transparent zone. So transparent zone for Streptococcus pneumoniae, which means it is susceptible to opticam. For viridine streptococcus, coming from the oral cavity, which means all those examples, Streptococcus mutans, bovis, what happened? They actually will grow there. You will see a big smear or some of the cloudy area. This is for Streptococcus mutans, bovis. So we call it a viridine streptococcus. Viridine strep. They actually resistant to opticam. Therefore, in the clinical medical area, clinical microbiology area, we could use the P-disc to differentiate that. It's kind of very interesting to do. It's a very quick test. And what's the results looks like? The results looks like the slides. Can you see it? That is on P-disc opticam. Left side, you see, doesn't have anything grow, Streptococcus pneumoniae. On the right side, Streptococcus mitis, that's one of the example of viridine streptococcus. You see it grow very well. So you can determine which one is Streptococcus pneumoniae, which one is Streptococcus with viridine streptococcus. Okay? So that's very interesting. And this slide we talk about ammonia, what it looks like. Diagnose chest x-ray, gram stem, culturing, and of course we have to use antibiotic therapy. But I also want to tell you there is vaccination, the vaccine for ammonia. people don't do that too much. If you go back to look at your slides, PCV vaccine, pneumococcal pneumonia, okay? There is a vaccine called PCV. It actually works to prevent streptococcus pneumonia, but people don't do that too much. Where that comes from, it is coming from the extract from the heavy capsule. So they get the heavy capsule, they isolate it, they get extracted, and develop this vaccine, which is called PCV vaccine. And they also need multiple shots for kids. Same as DTaP, 2 months, 4 months, 6 months, 1 year old, 1.5 year old, they have to do multiple boosters. So you look at the schedule of the immunization, you can recognize that. So luckily we had the vaccine for that. That's very, very nice. Okay? Okay, so we finished talking about this one. We want to talk about the next one is, I'll take this off, but finally I will do a conclusion, we'll repeat it again, okay? Conclusion is important. So we talk about the community-acquired ammonia, which is streptococcus pneumoniae. And there is another pathogen. And it seems like that's very confusing you. It's called Klebsiella pneumoniae. And because it's the genus name, species name is also ammonia, so it looks like confusing you. So Klebsiella pneumoniae. This is also called ammonia. However, it's not a big risk for ammonia. This is the one only for about 2 to 5% ammonia in the United States. Now, what is really for Klebsiella pneumoniae? This is for infant diarrhea and urinary tract infection. We will have a lab to talk about that in detail. Urinary tract infection, UTI. Not really for ammonia, although it's called ammonia. What this pathogen looks like, you look at the slides. Looks like cheese, is that right? So we call it a mucoid colony. It is kind of like a cheese. Very heavy smear. Why? Because of the heavy capsule. And for these type of patients, if he have ammonia and he does coughing, what you will get? You will get a current jelly-like sputum. And this looks like a brownish color. Current jelly is a product used in European countries. In the United States, we don't have that too much. Think about this like a grape jelly. Okay, similar to grape jelly. So you eat a breakfast, you put some jelly there in between the bread, grape jelly, something like that, the current jelly, it's a sputum caused by Klebsiella pneumoniae. And when you look at the slides, right side is blood agar. Left side is McConkey agar, it's pink. So, very interesting, this pathogen is also grow very well on the McConkey agar. And on the McConkey agar, it is very similar to E. coli, it is lactose fermentation positive. That's why it is pink. It is pink color. Same as E. coli, okay? So if you don't remember, it's same as E. coli. We will do McConkey agar recognition and the cultivation next week in the lab section. So you'll get to know the McConkey agar, get the hands-on experiences. So that's Klebsiella pneumoniae. Remember the mucoid colony, heavy capsule, and it cause UTI and infant diarrhea instead of cause ammonia. Next one, we will talk another group of streptococcus. This is called beta hemolytic Streptococcus. There is two groups. Streptococcus pyogenes and the Streptococcus agalactiae. And if you read all the all the medical textbook or medical report, in the clinical area, Streptococcus pyogenes, we call GAS. And the Streptococcus agalactiae, we call GBS. So that's kind of confusing what that means. Lots of the textbooks just write the name there, GAS, GBS, they never explain it. It's kind of confusing scholars to understand. So what does that mean? What does GAS mean? Rebecca Lansfield Group A strip. Okay, so we need to talk about that. Rebecca Lansfield is a great American microbiologist. 1895 to 1983, very long life. In 1920s, she did a great research with her group. Is isolate Streptococcus cell wall and the cell membrane systems of protein. And we treat them as an antigen. And then working with, we treat them as antibody. And working with an antigen from the rabbit plasmacilium. And what happened is the antibody-antigen reaction, they could be grouped all the Streptococcus into different results. And kind of like a serological typing. But not really, okay, a little bit different from right now. By the time going through antibody-antigen reaction, they're kind of like today's serological typing. The idea is to group different Streptococcus. Based on these methods, we could group lots of the Streptococcus into different Rebecca Lansfield groups. Here we only introduce you three important things, which is group A, Streptococcus pyogenes, group B, Streptococcus agalactiae, and group D, Enterococcus facilis. Now, you have a question. We just mentioned about Streptococcus pneumoniae. Why you didn't say anything about that? Because this Rebecca Lansfield group is completely focused on the cell membrane system, the protein. They typically need a special called M protein in the fluid mosaic model. Streptococcus pneumoniae do not have that. So, Streptococcus pneumoniae is usually, does not belong in any of the Rebecca Lansfield group. So we usually write NA. Okay? That is what GAS comes from. What is GBS comes from. And we also going to mention the group D Streptococcus Enterococcus facilis real briefly. That's a story before we talk about it. You look at the textbook right here. This is coming from their slides. Group A beta hemolytic streptococcal. That's all. And bracket GAS, I don't think you get it. And I don't think the people who are writing there get it. And this is the story. And you need to go back to do the little bit of search, and then you know it's a big story behind it. By all the time, there's no molecular technology based on antibody-antigen reaction. They could group the different streptococcus into different groups. And it's used in the clinical area right now after even 150 years. They're still using it. Okay, so that's Rebecca Lunsford group. Now we're going to talk about streptococcus. And group beta hemolytic streptococcus. So we want to talk about that. So that's just to take these off, and I left that in there. So first of all, Streptococcus pyogenes. Streptococcus pyogenes. What is PYO means? This is pus. It means dead, white, blood cell. Then what is GENES means? Genetic. That's very interesting. Okay, Streptococcus pyogenes. Everybody knows the typical symptom is in the slides. Tonsil area, whitish red smear and swelling. What that? Strep throat. And I make a joke. I said before pandemic, before 2020, all the excuse for you not attending AEM 341 microbiology class is you should be emailed early in the morning, say the Dr. Sure I'm not coming, I'm tested positive for strep throat. And I believe you, it could be. But most of the time, it may be just a virus. Okay, I don't know how they get it. So usually you go to see a doctor, in the hospital you have a cough, sneezing or something, they will say open your mouth, and sometimes from your nose area. Cotton swab, they do a rapid testing with antibody-antigen reaction to see whether you get strep throat. Because if you have a streptococcus pyogenes, you have to use antibiotics immediately, and this pathogen is very invasive and very risky. So what happened? The risk group for Streptococcus pyogenes